Hello everyone, today we will be discussing about the biomechanics of running and running injuries. The content we're gonna discuss today is the introduction, the difference between running and walking, and the phases of running. After that, we will discuss about the running injuries and the footwear modifications. Introduction. Running is similar to walking in terms of locomotor activity. During running, gait cycle, the ground reaction force COP increased to 250% of body weight, double that of walking. Running requires first greater balance, double float period, second muscle strength, elevation of hand, joint range of motion, absorb increased energy to control weight. The difference between running and walking is time and ground contact pattern in running alters than the walking. The greater joint range of motion is running, more eccentric muscle work, double and single limb support, period of double limb flow, less than 40% of stance phase, and more than 60% of the swing phase, and vice versa. Running speed is more, stance time is less, and the swing time is more. For running, increase in step length and step rate. Phases of running cycle. Swing phase, it includes initial swing, terminal swing, in stance phase, loading, mid stance, and propulsion. As you can see, the running gait as the impact drives in the propulsion phase. This is the mid stance phase. Here you can see there's a toe off, then the beginning of swing phase as initial swing, then here is the mid swing, and then the terminal swing. And again, the loading phase includes progression towards heel strike. First, the foot supinated with slight inversion 0 to 5 degrees, pelvis anterior tilt and internal rotation up to 10 degrees. If external rotation at 10 degrees and flex at 20 to 30. Knee flexion 10 degrees. In mid stance, during this time, ankle moves towards maximal dorsiflexion up to 20 degrees. Same time, hip and knee moving from flexion toward extension for assisting forward motion body of the center of mass. Maximum foot pronation followed by ankle dorsiflexion should reach rear foot eversion up to 10 degrees and forefoot abduction at 5 degrees. As the center of mass passed anterior to the stance limb. Next up, the propulsion phase following the heel off continue to supinate and plantar flex. In this, there is a rear foot inversion, the transverse tarsal joint converts, and the midfoot is locked. The initial swing at this time, swing side relies on contralateral gluteus musculare to dissipate the down reaction force produced by this event and prevent pelvic dropping in a swing side. The terminal swing. During this time, swing hip reaches maximum flexion up to 30 degrees before coming under control of hamstring and gluteus. SAM. Hamstring activity slows the rapid extension of the knee for preparation of heel strike and hip abductors. Control eccentrically to control abduction. Then adductors acts concentrically to bring hip towards the midline. Next, we have the kinematics of running in sagittal plane. In this plane, running exhibit out pelvic tilt and thigh angle. At initial contact, hip flexes 20 to 45 degree as we have discussed it earlier, after which it goes for extension till toe off. A terminal swing hip flexion decreases that lead to reduction of velocity of the foot related to the ground In runners, pelvic motion is minimized to conserve energy and efficiency. Next up, increase of lumbar lordosis from mid stance to toe off and from mid swing to terminal swing because limitation of hip extensor mobility may place lumbar spine in compromised position of excessive lordosis and also strain and hamstring muscle, which causes the back pain. At initial contact, knee flexes 15 to 25 degrees. At mid stance, knee flexes 45 degrees. At propulsion phase, knee extends up to 25 degrees. But in swing phase, knee reaches beyond 90 degrees of flexion. At initial contact, ankle in neutral. At mid stance, 20 degrees of dorsiflexion as leg is loaded. At toe off, 15 to 35 degrees of plant flexion, and that continues till preparation of heel strike. At the initial contact, foot goes for supination, followed by calcaneus inversion to 4 degrees. As the progression occurs, subtalar joint pronates, followed by hind foot eversion and tibial internal rotation. During the first period, first 20% of the stances. In the frontal plane, in this plane, hip is adducted 6 to 12 degrees with respect to pelvis from initial contact to mid stance. Then, from mid stance to mid swing, hip adducts 6 degrees to forward progression of body and clearance of swing leg. In terminal swing, hip returns to abduction for the preparation of initial contact. The transverse plane movement pattern in this plane important for energy efficiency. At initial contact, pelvic exhibit 8 degrees of forward rotation, hip external rotation of 10 degrees, then internal rotation to neutral. Foot shows maximum external rotation in mid-swing of 15 degrees. The kinetics of running are ankle, knee, hip power patterns are similar in running to those of walking. Only the velocity influences the amplitude. When forward speed of runner increases, the peak of ground reaction force and rate of loading increases. During running, sharp ground reaction force at initial contact resulting in an impact peak depends on foot strike pattern. After initial peak, ground reaction force reaches 2.2 to 2.6 times of the body weight in runners. During mid stance, ground reaction forces are highest on the bottom. The anteroposterior ground reaction force can alter through strike style, forefoot and heel, cadence, and running surface. There are some common running injuries. Running injuries. 70% of runners will suffer an injury in their lifetime. Running injuries don't just affect your feet and ankles. There are some severe injuries: stress fractures, plantar fasciitis, Achilles tendonitis. As we'll look at further, stress fracture, feet and lower legs, overuse injury. Sign of a stress fracture can include pain, swelling, redness, and possibly bruising of an area. Prevent injuries by wearing supportive athletic shoes. Plantar fasciitis, inflammation of the fibrous tissue, the plantar fascia, along the bottom of your foot that connects your heel bone to your toes. Presents as heel or arch pain. Painful first steps out of the bed and worse when walking barefoot. As you can see, there's the plantar fascia. The inflammation of the plantar fascia causes plantar fasciitis. It can be treated with an arch support and stable supportive shoes. Achilles tendonitis is a chronic overuse injury. Achilles and calf helps absorb the shock of the landing and during the push-off phase of the run. It may be caused by other biomechanical deficiencies, can be treated with a stable shoes. As you can see, the Achilles tendon. The running shoes. The right shoe may help prevent injury and promote the performances. So we will look forward to your foot type, the type of shoes, the shoes for your feet. The foot type, some people have a high arch, some have a normal arch, some have a foot flat. So the alignment should be supinated, neutral, or pronated. The foot types, there are three different types of foot. The height of your arch affects the direction and severity of the way your foot rolls or pronates. The type of shoes, the cushioning shoe, stability shoes, or motion control shoe. For an high arch foot type, with which alignment is supinated, the shoe type must be a cushioning shoe. For a normal arch, there's a stability shoe. For a flat foot, there's a motion controlling shoe. The right shoes for you is get measured and of an appropriate size. Have a foot assessment and talk about your injuries and pain if you have a previous injury while running. Wear a sport specific footwear and analyze your old footwear. Replacing a running shoes. When to replace? After 300 to 500 miles, when causing pain while running, or it has an uneven wear. This is all it about the biomechanics of running. Thank you.